All right, welcome everyone to our community education resources for residents and families. We're going to go ahead and get started. First, I want to thank our sponsors for helping VOYCE make this education program possible. Because of the help of these generous sponsors, this program is free to attend. If you forgot to opt into our sponsor prize drawing, please email your name over to events@voicestl.org to enter. Your information will be shared with our generous sponsors, and then we will select winners at a later date. If you want to learn more about long-term care, we do have other upcoming community education webinars. These are also free. We have one each month between now and November. You can see that list right here. If you would like to learn more about any of these webinars, who the speakers are, a little bit more about the topic, or register, you can visit that link below or just go over to voicestl.org. I'd like to welcome our panelists today. So first we have Chen Hung and then Jessica Rogowski, and they will all be doing brief introductions here shortly. Katie Morrison and Libby Sykes, Jen Joy, Heather McDonald, and Goen Kwan. So I will go ahead and stop sharing my screen eventually. All right, so I will bring it over to our panelists to let them do brief introductions of themselves so that you know who is speaking and what areas they oversee. All right, if we want to go ahead and start with our ombudsman, you can go ahead and introduce yourself. Chen, do you want to begin?
Oh, sure. Thank you, Lindy. My name is Chen Hung. I am the program director of the long-term care ombudsman program, and I also supervise the mental wellness program as well as Voice Connect program. And we certainly will talk about the programs a little bit later. Now, I am gonna have Jessica introduce herself.
Good afternoon. My name is Jessica Rogowski, and I'm the Regional Ombudsman Coordinator for Northeast Missouri, which consists of 16 counties and St. Charles County.
And Katie.
Hi, everybody. I'm Katie Morrison, and I'm the Regional Ombudsman Coordinator for North County, St. Louis, and for St. Louis City.
Now it's Libby.
Hi, I'm Libby Sykes. I am the Regional Ombudsman Coordinator who oversees the area that we refer to as Central St. Louis County. And I'm also the volunteer coordinator. So reaching out to me if you have any interest in volunteering as an ombudsman.
Wonderful. And Jen.
Hi, I am Jen Joy, and I oversee the areas of Jefferson County, South County, West County, and Franklin County.
Great. And that we also have our lead regional ombudsman, and her name is Lisa Smith. So Lisa is not able to join us today because Lisa is actually out of town. But Lisa's direct line is 314-919-2404, and she oversees St. Louis City. So with that, so I'm gonna give the microphone back to Lindy.
Thank you to all of our regional ombudsman coordinators. Next, we'll do an introduction of Goen.
Hi, everyone. My name is Goen Kwan, and I'm a Voice Connect and Outcomes Management Coordinator. I will explain about Voice Connect program later on. And other than that, I oversee lots of data that we have for our own.
you. And Heather?
I'm Heather McDonald, Mental Wellness Navigator, and I reach out to 17 skilled nursing facilities in the city of St. Louis.
Thank you, everyone. So to begin, we're going to start with our Ombudsman program, and we're going to kind of let each of the panelists talk a little bit about that. And if you do have any questions, feel free to share those in the chat, and we will address those at the very end. But I might also have questions kind of throughout. So to begin, Chin or any of the ombudsmen, can you briefly explain to our audience what the Ombudsman program is for?
Great. So I will start, and then I will hand my microphone to our ROCs. And ROCs, that's ROC, meaning Regional Ombudsman Coordinators. So the Ombudsman program actually started in the 1970s. And that is actually a federally mandated program for all 50 states. Each state is allowed to kind of run their own ombudsman program, for their state. So in Missouri, our ombudsman program is divided into different regions, and VOYCE, we oversee 20 counties plus St. Louis City, and so with that. Each of our ROCs, we can kind of briefly talk about your particular counties and the most significant issues that you encounter lately. Or not lately, the past 5 years, that's fine too. So let's start with Jessica. Jessica, what is your region about?
So I cover the Northeast region, which is 16 counties. It's in Nemo. And some of them are rural, some of them are larger towns. And then I cover the St. Charles County, which is larger. So in Nemo, I have 79 long-term care facilities, and these are all licensed facilities or skilled nursing, assisted living, and residential care. And then in St. Charles, I have 41.
Great. So I understand that in Northeast Missouri, you have a very unique kind of issue there. And would you like to tell us what that is?
So within Nemo, with it being a smaller rural area, so in some of the counties, your typical nursing home, they house, residents that were team members. So you might have a staff person working there and that will recognize, this is my school teacher, this is my principal, she owned the restaurant in town. So it makes it very unique compared to St. Charles County or even Marion County or Adair County, where there are larger counties. So their issues are just very unique compared to everybody else. So in those smaller counties, then you have your family issues, you have your town issues, that because it's a small town, and it's very different compared to, let's say, St. Charles County, St. Louis County, and St. Louis City.
Yes. Thank you, Jessica. And now Katie. Katie oversees North County, and then how is North County doing, Katie?
North County keeps me pretty busy. In the past, I've had other areas, but I've really had to stay focused on North County. There are 32 skilled, so it's a lot for visiting. I would say it's typical complaints you would get from any nursing home with understaff, staff attitudes, being late to call lights, different things about food, variety. Sometimes guardianship issues come up as well. So basically those typical kind of complaints that you would hear from any facility.
Right. So Libby, your central county is consists of say Webster and U City and Kirkwood. So how are they doing?
Yeah, I mean, I think that I have a lot of the same things that Katie experiences. Right now, the biggest one all relates back to staffing, because that affects the call lights, that affects The showers, I hear a lot about not getting, the showers they should be getting. And the reasons all go back to, well, we don't have the staffing to do that. We don't have the staffing. So I think the biggest one right now is staffing, and it's just trickling down and affecting the residents in a lot of different ways.
Thank you, Libby. And Jen is actually our newest member on the team. And then Jen has a lot of experience working with different populations, working in the hospital. So Jen, what's going on with your region?
So I have South County and West County and Franklin County and Jefferson County. There are a lot of skilled nursing facilities in those 4 counties. So it certainly does keep me busy. I'd say a lot of the issues are very similar to Libby and Katie, particularly now in the situation that we're in. So a lot of it is staffing, call lights, showers, just not enough help. And so pretty much, similar issues as the other ladies have said. So.
Got you. Great, thank you. And then I forgot to mention that in Jessica's Northeast Missouri region, there is actually a lot of issues about guardianships, and therefore Jessica then was trained to become an expert on guardianship issues. So if you guys have any guardianship issues, Jessica is the person to contact. Now let's give it back to Lindy.
Thank you. And if you have a need for an ombudsman, or if you want to learn more about our ombudsman, you can visit the link I'm about to drop in the chat. We will address some more questions later, but I will just quickly ask, because we have a few minutes for their section. Would someone be able to talk about the guardianship that you just mentioned and what that means for a resident and their rights?
Sure. Then let's have our expert Jessica talk about guardianships.
So if a person's deemed incompetent, they typically are granted a guardian. So a guardian could be a family member, it could be a public administrator, however, it has to be granted through the court system. And they are the ones that will make all the health and pretty much make all the decisions for the resident. So in my case, I have a few places that are pretty much all guardianship. All the residents have guardians. And so they have a little bit more, I get more calls from them just because sometimes they don't understand how what happened? How did they end up with a guardian? How do they restore their rights? And to restore rights is also a court process. And so it's a lot of calls and a lot of explaining to residents because most of the time they're hospitalized when this happens. So they don't even understand what happened. All they know, they were out in the community. Now they are in a skilled facility. So I spend a lot of time working with them, trying to help them understand what to do and how to navigate the system.
Great. So thank you, Jessica. So there was just a question dropped in the Q&A part, and then I wanted to clarify that. So when I said Jessica is an expert on the guardianship issues, actually that is not say a certification that you can get. So what I'm trying to express is that Jessica has a lot of experiences dealing with guardianships because in Jessica's region, there are actually several nursing homes. Each nursing home has a couple hundred of people. Every and each resident actually has a guardian. They are not their own responsible party, and they are not to make decisions by for themselves. Therefore, Jessica has accumulated years of experience dealing with guardianship issues. That is why I call Jessica an expert. She's seen it all, done it all. So with that said, Lindy, do you have other questions?
Yes, I do have one more question. Can can you talk about the residents' rights and how those loved ones may be unaware that their residents do have these certain rights?
Sure. So VOYCE, we have this very, very nicely made kind of resident rights cards. And also the state also has their card, the resident rights card here. So we have a lot of those in our office. And if you need a resident rights card, you know, we can provide you resident rights cards. So there are different 9 different categories on our card. For example, you have right to participate in your care. You have right to choose your activities, your schedule. You have the right for the nursing homes to accommodate your needs. All the way to you have the right to remain in the facility, meaning that they cannot just kick you out if they don't like you. So there's one right about this, that is that the resident, they have right to refuse the treatment. Say the residents are asked to take some kind of medications. Residents are asked to participate in some kind of, let's say, ECT treatment or other rehab program treatment, and then they have absolutely every right to refuse. That is resident rights. One of the resident rights that a lot of times people don't remember. In the meantime, we also need to know that the resident has the right to make decisions that we don't think are beneficial to them. But as a professional, we have to support them, and that is their right to make that kind of decision.
Thank you, Chin. We will open up at the end for more questions, but now I would like to turn it over to Goen to talk about VOYCE Connect and let you all know the resources that program can provide.
Yeah, thank you. So VOYCE Connect program is a helpline providing long-term care related resources to family caregivers, older adults, or even some other professionals from different organization or hospital based on our database. So we all know once we start our footwork of caregiving, finding resources, there are so many, maybe too many resources out there, and we are not sure whether that is an advertisement or sales pitch. So, I even once mistakenly write my phone number on insurance quote, and I got like 10 scam calls a day. So I had to change my phone number. So VOYCE Connect Helpline is kind of the program that help you to find a place or find some other professionals, not doing those whole chaotic search on Google or other web page. So I like to mention what kind of resources that we maintain. So first of all, resources for other professionals like geriatric case managers who can do needs assessments or Medicaid help or ongoing case management. So we have some lots of professionals who are in this field, and also some elder law attorneys for also Medicaid process, or even for help assistance on asset problem or estate problem for elderly parents or grandparents. So we have pretty decent professionals you can contact based on your choices. And some home health care agencies is also the one that I often provide to caregivers, from companionship care to nursing aid in someone's community or someone's house. Also, we have adult daycare centers list and transportation companies who can provide transportation for residents in a facility who needs dialysis or other medical appointments for residents. But our main resources is long-term care facilities, from assisted living homes, residential care, and skilled nursing homes. We have more than 300 facilities information in St. Louis City, County, Jefferson, St. Charles, Franklin County, and further northeast Missouri, Lincoln County or Warren County. And so we have pretty valid information. And not only like names of facilities, we have like what kind of payments they accept, like whether they accept Medicaid or Medicare, or even we have some facility that have VA contracts. So if the residents has a VA benefits, then I can narrow down facility that have VA contracts to, contact them first. Also, like health accommodations. So whether the facility has memory care units or behavior units, or even Wonder Guard in the facility, or locked unit for people with dementia, and also like some like difficult situation like chemical dependency or track patients, and some health accommodation that we manage. And the good thing is we try to update this list as frequent as possible. So we recently updated during COVID time. And then now we are also in the process of we think this is the pinpoint period of getting information on whether they are open to new residents and open to COVID positive patients. So we are on a process of getting those information with our practicum students. So we, Voice Connect Helpline tries to make our list and resources as comprehensive possible.
Thank you, Goen. I think one of the things that can often confuse people about Voice Connect is that it is a resource program. It is not a referral. We cannot make referrals. Can you explain why that is?
Yeah, sure. Chen always open to chime in. So because of this whole ombudsman program we have, and also like funding system and like regulation from state office, we are not allowed to recommend certain facilities or evaluate certain facility because it is kind of conflict of interest and violate the regulation. So oftentimes I also understand, even myself, if I am looking for a nursing home for my parents, I will find the good ones and I will ask which one is the good one. But so because we cannot do that, I also have some very substantive web pages from like ProPublica or Medicare that is kind of valid information that out to public, like Medicare rating or results of nursing home inspection, that kind of general information that I can share with caregivers or older adults.
Yeah. So thank you, Goen. So the information that especially when it comes to ratings, when it comes to, well, if this nursing home good or bad, is this a good option for my mom? Well, we cannot make that decision for any family members for two reasons. First, we are not part of these callers' family. We don't know what actually mom needs or what mom doesn't need. We don't know what all the family members where they live. Therefore, a nursing home option would be geographically more convenient for the family to visit. So we don't know any of those things. Therefore, it's more appropriate for for mom, for the family members to actually reach out to these nursing homes to figure out which one fits the needs the best, which one financially or care and services wise is the best one for our particular family. So now, that being said, the other thing about the program is that since our entire organization, we receive fundings from the state as well as we receive fundings from the federal government. We actually cannot be non-partial. In other words, we have to remain in a we have to remain non-partial. That's what I'm trying to say. So therefore, when it comes to ratings or recommendations, GOIN and the Voice Connect program cannot tell people, well, go to nursing home A, but don't ever go to nursing home B and C. That's not why we're here. That's not how we do things. And a quick example is that there was a nursing home that we used to deal with, and then we thought that the nursing home had a lot of issues because the residents and the family members, they thought the nursing homes the way they run the nursing home, they manage the care, the services they provide, it was too rigid, too restricted, and this was a few years ago. And then turned out one day I actually received a phone call from a resident as well as the resident's sister, that the resident from this particular nursing home that no one liked, I thought. Then turned out the sister could not be more appreciative for the nursing home structure and all kinds of restrictions. And she told me that, well, if it weren't this particular nursing home, my brother would have been dead because of drug issues. Now, because the nursing home is in a pretty rigid kind of environment, and then they have a pretty specific structures for the residents to follow. Then the resident, the brother, once he got into this nursing home, there was no chance for this resident to actually get drugs, to get illegal substance, and that saved his life. And he loved that nursing home, and the sister could not be more appreciated for the nursing home's assistance, as well as our assistance. So just when I thought that, well, this nursing home got a lot of problems because no one liked this nursing home, turned out it was not true, because this particular nursing home actually fits this particular family's needs. Therefore, we cannot make that decisions for anyone. So GOIN can provide the information, but the callers, the family members, you guys will have to make that decisions, do the interviews, do the tour yourself.
Thank you, both Chen and GOIN. I think one of the things that we can all take away from that is that this is not a one-size-fits-all situation. And also, our list is comprehensive, and it is not a pay-to-play type of list. It's not the facility with the biggest marketing budget that gets the recommendation. It's, what fits best for you or what your needs are. Here's a list to help you narrow down your search. Thank you. Now we will move on to Heather, and she will talk about our mental wellness program.
Yeah, so our mental wellness and skilled nursing, brand new program. We have several partners with this: Providence Behavioral Health, Memory Keepers, SLU's Family Medical Therapy Program, St. Louis Behavioral Health Network, and Missouri Show Me Hope program. We're all really integral in making this program come about. In my position, I'm focused, like I had said, on the 17 skilled nursing facilities in the city. There are many, but of them, I have 17. Those names will be dropped into the chat. So if you have a family member, a loved one, if you're a resident or you're a staff member in those homes, you can all access me. So you can email me, call my direct line. Those two will be given out today. So in this position, I'm really focused on decreasing loneliness and isolation in this population. Certainly they were already dealing with a lot prior to COVID. I'm sure many experienced loneliness and isolation prior, but COVID just exacerbated everything. So for residents, we're going in, I'm going to talk about two of the groups that we have going. But in essence, I meet with each individual that the skilled nursing facility has said, we're worried about their mental health, and they would like to meet with you. I can certainly do so. For folks who are having a mental health crisis, they can utilize the Providence Senior Mental Wellness Helpline. And this is, I'm sure you've heard of like BHR and Providence Regular Behavioral Health. This is actually a private crisis line that they can access. So that number will be in the chat. It's 314-446-5156. They'll be connected with a licensed clinician to discuss their feelings, their concerns on a 24/7 basis. So it's also available, if you're a family member or a loved one that wants to talk about like symptomology that you're seeing with your family member that's concerning you. Maybe it's new symptoms that you've never seen before or worsening or just continued, and you want to kind of talk through that with someone who is licensed to really help you with that. Also, Show Me Hope. Missouri Show Me Hope program is something that we all can utilize if we've been affected by COVID, and all of us really have. So residents, families, and staff can utilize that. Funded through FEMA. It is actually extended to 2022 for extender agencies. One of them is Behavioral Health Network, who has been really, really helpful in this process. They have CCP, Crisis Counseling Program. So the crisis counseling program model is different than therapy, a therapeutic model. So these folks are counselors. They are lay people who have been trained. So it's really a pure modality. If you are in the 17 and you're wanting more of a therapeutic eye on something, that's Provident. The other, Show Me Hope. Just want to differentiate that. It's important to know who you're on the phone with. So with the Show Me Hope program, that CCP, Crisis Counseling Program piece, up to 5 sessions can be covered with a crisis counselor. You can look at stress management and tools and tips and tricks and just kind of how to structure your life a little bit better so you can have some good results and cope and have better mental wellness as a result. So then I told you about the groups that we're doing. So I think it's important to differentiate, like, this is not a 12-step NAAA type OA type group where you're going to get up and talk about what's going on with you and be put on the spot in a way. This is not that. It's also not a therapeutic group that is run by a licensed clinician where you like dig into your history and your family of origin and like all this stuff. It is actually almost a rec activity type group. So the idea behind it the residents don't necessarily go in going, oh yeah, this is going to work on my loneliness, my depression, and my social isolation. They just know that they're going to have a good time. It's going to be themed activities. It's going to be camaraderie with a peer lens, you know, folks that are in there between 5 to 8 individuals in each group, depending on which one, and I'll tell you more about them. But the camaraderie is going to naturally decrease those feelings of social isolation, which we may see when we measure using a UCLA loneliness scale. We use the abbreviated version that AARP puts out. It's a 10-question UCLA. I also use a PHQ-9. Many of you will be familiar with that. It's a depression screening tool. PHQ-2, if you know about that, it's the extended version of a PHQ-2. And then the SLUMS is like a mini mental status exam, similar to that, a little more extensive. And it is obviously a SLU's creation to deal with, you know, measuring cognition. And so with the circle of friends, like I was mentioning, you know, 5 to 8 is good, a good range. And the idea there is just to make new friends, feel less lonely, and experience meaningful activities with other group members. Anytime we talk about a group, we want the group to kind of go on without us after we phase out. And so after the 12 weeks, you know, some folks continue to see each other in the halls, and they continue to have a camaraderie that can be really integral in creating like a wraparound social network for them. Because certainly, even though COVID restrictions have loosened and things can calm down at some point, we hope, right? The feelings of social isolation can continue. So we want that camaraderie to be established within those groups. Also, Memory Keepers cognitive stimulation therapy group. So it's intended for folks that are having difficulty with cognition. Maybe they've been diagnosed with mild to moderate dementia, not severe, but mild to moderate. We do, of course, do that pre and post slums to kind of see where they're at in that. The group meets once a week for a total of 14 weeks. And those folks that have been tested also have had and that's in the function of like measuring within a study, but we just kind of have read that individuals are having a decrease in feelings of depression. So the sessions really stimulate folks, they engage them, they do reality orientation. So there's a board, you know, what's the date? What is the weather today? Is this typical for this time of the year? Because a lot of that can be lost when you're in a facility. And so then also it gives them like an optimal learning environment because it is formatted. It's the same sort of structure, is similar each week. They have a theme song, they have a group name, they have a warm-up activity, and then they have different main activities. Some examples of that are they have current events where they kind of get into a healthy debate about politics and things like that. They talk about music, and they bring, like, they have a matching game where they bring pictures of themselves when they were young, and then the individuals try to, oh, well, I wonder who that is. And it helps them with bringing past orientation to the present. And so that's really helpful with those folks who have some dementia going on. So really excited about the program. Definitely want to hear your questions about it. If you are not in one of the skilled nursing facilities that's been dropped in there, but you have a question, certainly let us know what that is. Excited about the program, so thanks.
Thank you, Heather. So we do have a couple questions, and we are going to open up these last 20 minutes of the session to your questions. So if you have a question about, the Ombudsman program, or your loved one that's in long-term care, or maybe yourself and the care that you're receiving, drop that into the chat or the Q&A, and we will try to get to that. If you have questions for GoIn and Voice Connect, certainly drop those in as well. If you need clarification on anything, we're happy to help with that. And then, as Heather said, if you have any questions about the mental wellness program, let us know. I will go ahead and start. We got one earlier that was a little long, so I'm going to try to abbreviate this. This is from Linda. Since many of the ombudsmen talked about staffing, this is related to that. Given that many of the issues are the same across the region and state, especially regarding staffing, what do you attribute this to? Is it staff training? Is it compensation, or facility leadership or lack thereof? Is it communication skills, or cultural diversity training? What can be done to be making this better?
So that's a great question, and also a very, very big question that probably we will need another 1 hour to just answer that question alone. But just to kind of answer it briefly, and I think all of the above that Lindy you just read from Linda's message, that all of the above, including their training, including just everything, that would be the reason why staffing is a problem. Now, that being said, there's the bottom line of this, which we heard all the time about the staffing issue, is that these clinicians, these workers, these people, they are not the CNAs, they are not paid enough. Therefore, when you are being paid with minimum wage, then people, unless they really love this job, they really have passions for this particular profession, they rather go to McDonald's to flip burgers there. So I think that is actually the very fundamental issue here. The workers here that actually do the job, they do not get compensated enough.
And I would like to add that, like, one of the things that I hear about staffing usually is always with the caveat or an explanation that the staff that's here is wonderful. I hear that a lot when they're talking about being understaffed, especially from the residents. They'll say, don't get me wrong, I love almost everyone that works here, but they say they're understaffed, so they can't get me the things that I need. So I think that, like Chen said, that goes back to the compensation. The training and everything is important, but the people who are there a lot of the times are very passionate. And so because they're working at that job, which is really difficult for low pay, clearly there's a lot of passion there. So a lot of the times there's really, really good staff. There's just not enough staff because a lot of the times it's that compensation. So.
Thank you. Linda had another question. And this one is particularly, I think, for Heather. So how does the mental health wellness program interact or coordinate care with the psychiatrist or psychologist working within the facility? And if your loved one is not at one of the skilled nursing facilities that we listed, can they still access the mental wellness program?
Yeah, I mean, I really focus on the 17. However, I certainly can navigate you in the right direction if you're wondering about, something in regards to assisting your loved one with their mental wellness. So for individuals that have significant issues that are already being addressed by the psychiatrist, the therapist. Maybe they have telehealth going on. Maybe the psychiatrist does rounds at the facility. They typically do not reach out to me. I am not a clinician. I have an MSW, but I never went, the clinical route. So that being said, I can help navigate. I, in some respects, kind of do sort of the case management assistance piece. So certainly you could reach out to me. I would say that if you're not in one of the skilled facilities and you want to learn more about, well, what is in my area? And if I do want a new psychiatrist, how do I go about that? I can, or Lindy can, one of us can assist you in just accessing those blogs. And those blogs have resource links in there. Perhaps the person has mental health emergencies on the regular and they are outside of the 17, and you want to know more about BHR, or you, like I said, you want a new therapist or psychiatrist for somebody, and you want to access Psychology Today link and look at your zip code and navigate that. We can help you with that. Also, like I had mentioned, the Show Me Hope program is kind of a catalyst. And if I had like one phone number to share with you, it would probably be that one, because then through FEMA and everything, they, since they're going to be around till 2022, they can assist you in like some of this as well, finding out exactly what your needs are, do you need crisis counseling? Do you need just a referral? So there are other numbers that I can definitely give you for Show Me Hope Missouri. So in short, that's what I have on that.
Thank you.
Let me know
Heather.
if you have any other questions.
Just to, sorry, Lindy, and thank you, Heather. Just to clarify that, when Heather mentioned the BHN, that actually is short for Behavioral Health Network. That is actually a very well-known organization that provides behavioral health related resources in the St. Louis area. So just an FYI there.
All right, thank you. And someone actually mentioned this, and I did respond to them in the Q&A box, but I think there is often some confusion around the term long-term care. And Chin or whoever can explain this, I'm sure better, but the way I've always seen it is that long-term care is the umbrella, and then the different types are underneath it. But Chin, do you want to go ahead and explain what is considered long-term care?
Sure. So each state, they have a little bit of different definitions about long-term care. And then in our state, in the Missouri, there are 4 different levels of long-term care in the long-term care system, and they are from the highest level of care to the lowest level of care. They are skilled nursing facilities and intermediate care facilities. And then 2 lower level of cares, they are assisted living and the residential care facilities. So these 4 different levels of facilities, or now we call them communities, they are considered long-term care. in Missouri. So in Missouri, there are, of course, other different kinds of housing programs or group home or, communal living kind of type of living situation. But if that's outside of these 4 different levels, they are not necessarily considered long-term care, for which then the ombudsman program does not have jurisdictions to intervene.
Thank you, Chen. This question comes from Michelle. Do families have any recourse when a facility is expecting full payment, but is continually using the excuse of short staffing, understaffing for not providing the contracted services that they are being paid for?
Well, I would say, maybe it is this is my way to look at it. Okay, so regardless the payment, the recourse. Now, sufficient care, that is sufficient care. Insufficient care, that is insufficient care, and that doesn't have anything to do with payment. Okay, so when the service, when the care are provided, and that is not good care, that is not quality care, that is not sufficient care, then that's a problem right there. So it doesn't really have anything to do with, your payment, expected. Therefore, we're gonna provide you the care, because let's say in one nursing home, there might be private pay, there might be Medicaid beds, and there might be Medicare rehab beds. So we cannot kind of discriminate and say that, well, private pay, we're gonna provide the best care, and then for Medicaid beds, we gonna provide so-so care. So therefore, I would say the payment part, the money part, that's a total different issue here that we don't really have to get deep into. What we are always gonna look at is if the care is sufficient, if mom and dad are getting good services in this place.
Thank you, Chen. Jessica, this was directed specifically towards you. It says, can Jessica briefly talk about the exceptions to 30-day notices in nursing homes, such as harm to self or others, and are assisted livings really not required to give residents a 30-day notice in the state of Missouri?
Facilities should be giving a 30-day notice if they're going to discharge. Now, there are some incidents where if a person is actively assaulting or abusing someone or harmful to themselves, like trying to commit suicide, then they can give an immediate discharge. Now, immediate discharge was typically to the hospital, but the facility should try to help the hospital find another location for them, or else that would be considered hospital dumping. Now, in the case of a 30-day discharge, it could be a range of different things. However, with that 30-day notice, it should also have a placement for the resident, because they can't just discharge the resident to the street, back to their home, and they need to find an appropriate placement. However, with all discharges, an appeal can be filed, and then it goes to the hearings unit to have the final say. So if the resident could stay at the facility, or if the facility was correct about the discharge.
And thank you, Jessica. And also, when a home is no matter which level of care, when a facility is discharging a resident, there has to be a discharge letter. So there's no such a thing as a verbal discharge. You just simply cannot do that. So and then for certified homes, they will also have to include ombudsman program in their discharge letter, and then we get a copy of their discharge letter, so that then the discharge letter will be considered as valid. So that being said, that means that a certified home if they issue a discharge letter without including ombudsman program in it, that the discharge is not valid. And then no matter, like Jessica said, no matter which kind of discharge, no matter that is 30-day, no matter that is emergency, immediate discharge, it can be appealed.
And also the placement is very important, because if they have no, let's say they're given a 30-day discharge and there's no placement because they didn't give a letter, it's thrown out also. So that's why it's always important, if you have a loved one that's received a discharge letter and you had questions, just contact us, because in a lot of cases I've had many incidents where, especially with assisted livings and RCFs, where a discharge letter was not given, and then I have to call them and get that taken care of, because a lot of times they don't think that they need to give out a discharge letter when it's all levels and an accepting placement for the resident.
Thank you both. I am going to give Goen a question, but before I do, I just want to share with everyone, I'm going to put a link in the chat, and it is to VOYCE's blog. Within our blog, we talk about a lot of different topics that could definitely be very beneficial to residents, families, professionals in long-term care. Just to give you an example, today is World Elder Abuse Awareness Day. So we do have blog posts about abuse and neglect, identifying it and how to report it. But also, we do talk about, the cameras in nursing home rooms and what that entails. We talk about a lot of varying topics. So definitely give our blog a look and see if, this has some resources for you as well. Heather has contributed a couple posts about mental wellness and resources available. So that is also on the blog. Definitely go check that out. And let's see. Goen, can you talk briefly about the community resource directory?
Sure. Yeah. So we also have a consumer resource directory, which I've been updating every month, and we are getting weekly change sheets from the state office with administrator changes or bed status or facilities name changes or capacity changes or level of care changes. So I keep tracking of those information and update it monthly, and you can find that on our website and there's a link to purchase the directory through the website. We do not have paper copy at this moment. We only have online copy version, and it's a PDF file of all the facilities that we have, and also some elder law attorneys or geriatric case managers on that one paper, not paper, but a book of whole information, like just for one, going to our website and then see those resource directory. And, like I mentioned earlier, we are trying to keep this thing most recent as possible. So I think, and we have several people who kind of called me to get this directory updated version because they wanted to keep it handy, in case of future needs. So we have those people also. So yeah, this kind of senior online senior resource book is really helpful to keep up to date those facilities every now and so.
Yes, thank you so much, Goen. Yeah, we actually have had people reach out to us and explain that they were made aware of the community resource guide from their elder law attorney for their parents, and it prompted them to then seek out our services, and it was very helpful because they were from out of state trying to plan for the care of their loved one that was in St. Louis. So that community resource directory is very helpful. We are wrapping up our time today. Just a little housekeeping. There will be a survey that when you leave the session, you will be prompted to fill out this survey. We would love your feedback. It is greatly appreciated so that we can continue growing and improving our education series. I have dropped into the chat a link to the staff directory and their contact info. So if you have specific questions or you need to contact an ombudsman for your area, you can find their information there. And then also, just so you know, you can always just go to voicestl.org. Our website is very comprehensive. We got a new website last year. It's a lot easier to navigate, so it can definitely point you in the right direction. If you need a recording of this, please feel free to email us at events@voicestl.org. We're happy to send you a recording, and we will send you some emails with resources available, such as the things that Heather mentioned, or some of these links that I have provided throughout the chat. So thank you, everyone. Please fill out the survey whenever you depart. We appreciate you joining us today. Have a great one.